Assalamualaikum warahmatullahi wabarakatuh. Hello everyone, my name is Savitri Puspitasari. I'm from Health Polytechnic of Semarang, and for the next 10 minutes I shall be talking to you about the use of mobile health application in diabetes mellitus dietary setting. If you have any question while I'm speaking, please save them for the end of the presentation. This is my mind map. Before I start, have you ever heard that mobile health application? Okay, the mobile health application is part of digital health or electronic health, e-health, which also includes health information technology, remote medicine, and personalized medicine. Diabetes mellitus is a chronic metabolic disease resulting from the body not being able to produce enough insulin or the body being unable to use insulin effectively, resulting in an increase in glucose levels in the blood or known as hyperglycemia. In 2016, diabetes mellitus was the direct cause of 1.6 million deaths worldwide. This graphic gives the illustration of Indonesia ranks F7 in the world after Mexico with a percentage of diabetes mellitus which reached 10.7 million, 11.5%, and is expected to continue to increase in 2030 to 13.7 million, 1.9%, and 2040 to reach 16.6 million, 18.2%. Management of diabetes mellitus is a challenge for patients and clinicians. In order to successfully manage diet, exercise, medication, and insulin doses, the patient must have a high level of health literacy and numeracy. Decision of the motivate behavioral change, interpret blood glucose trends, adjust drug doses with a short visit to the clinic, sometimes engage with patients who might have a limited understanding of their condition or treatment plan. This paper will argue that one way to optimize metabolic control, prevent complications, and to improve the quality of life of people with diabetes mellitus is to use a mobile health application. Firstly, this paper will identify key terms in the literature surrounding diabetes mellitus. Secondly, paper will focus on mobile health application. And finally, this paper will discuss the design of mobile health application. Before further discussion, it is important to know about the complications inside of diabetes mellitus. Patients with diabetes mellitus are characterized by high blood sugar level accompanied by impaired carbohydrate, lipid, and protein metabolism as a result of insulin function insufficiency. Salas Alvado et al. 2016 explained that diabetes mellitus, characterized by high blood glucose, is not only among the top 10 causes of death worldwide, but it is also a strong risk factor for blindness, renal failure, and lower extremity amputation, which reduce quality of life, lack of physical activity, sedentary lifestyle, poor diet, smoking, and excess fat are major risk factors for developing diabetes mellitus. Efforts are being made to reduce the incidence of diabetes mellitus and reduce complications and death by using a mobile health application that can help increase the knowledge of the sufferers. According to some authors, Haskas, Iskiani, and Restika 2021, the mobile health application is more effective for improving self-management in people with diabetes mellitus because it does not cost a lot and takes a long time compared to direct control to health facilities. This application can also always be accessed whenever we want. In addition, almost everyone has a smartphone in which it is equipped with applications that make it easy to download health applications according to their needs. This application covers 3 of the 4 pillars of diabetes mellitus: namely blood sugar control, nutrition education, nutrition intervention, and physical activity. The system in this application notifies patients to complete the self-management program in the form of a notification on their mobile phone. Firstly, the design of a mobile health care application on behavior change requires a thoughtful, patient-centered, and evidence-based approach. Patients with diabetes who are not treated with insulin require self-management tools that enable self-monitoring, provides actionable knowledge, and facilitate behavioral change. Self-care based on social cognitive theory (ACT) has previously shown positive behavioral changes, leading to improved medication adherence. Secondly, the design of mobile health application for glucose monitoring took a pragmatic approach that requires patients to measure their blood glucose levels on a specific schedule and tailor their diabetes care based on one identified pattern, guiding them toward better self-management. Thirdly, the design of mobile health application on increased physical activity. Both aerobic and resistance training in diabetes can improve glycemia and overall diabetes control, in addition to a decrease in the levels of physical activity. Fourthly, design with dietary intake content adherence to dietary recommendation, which is a key component of diabetes management and achieving metabolic goals. Food photography is an approach that allows users to easily capture high-quality footage without having to rely on memory-lengthy notes, potentially reducing barriers to self-monitoring of food intake. To bring self-awareness to food intake and increase link between dietary behavior and glycemic control, Bantu will promote food photos via reminders and will automatically associate photos with the appropriate context of blood glucose reading. Finally, weight loss by overweight and obese adults with diabetes might not only improve glycemic control but may also decrease cardiovascular risk. Managing weight is a key component to achieving metabolic control and will be included as a holistic approach to overall diabetes management. In conclusion, diabetes mellitus is a chronic disease characterized by high blood glucose. The main risk factor for developing diabetes mellitus includes lack of physical activity, a sedentary lifestyle, poor diet, smoking, and excess fat. The use of mobile health application is effective in helping to improve self-management of people with diabetes mellitus because it does not cost a lot and takes a long time compared to direct control to health facilities. The application can also always be accessed whenever we want. This application covers 3 of the 4 pillars of diabetes mellitus, namely blood sugar control, nutrition education, nutrition intervention, and physical activity. The system in this application notifies patients to complete the self-management program in the form of a notification on their mobile phone. This application is also designed of patient behavior change, glucose monitoring, physical inactivity, food intake, and weight management. So, diabetic must take care to avoid complications, and I hope that the mobile health application can prevent complications of diabetes and not increase diabetic. Before I finish, let me just summarize the main point. This application covers 3 of the 4 pillars of diabetes mellitus, namely blood sugar control, nutrition education, nutrition intervention, and physical activity. The system in this application notifies patients to complete the self-management program in the form of a notification on their mobile phone. This application is also designed of patient behavior change, glucose monitoring, physical inactivity, food intake, and weight management. Thank you for your attention, ladies and gentlemen. If there are any questions, I'll be delighted to answer them. Wassalamualaikum warahmatullahi wabarakatuh.